TB spondylitis or Pott's disease. Tuberculosis. Tuberculosis is a chronic infection caused by Mycobacterium tuberculosis. The extrapulmonary tuberculosis. Tuberculosis of extrapulmonary tissues is most often a spread of infection via the bloodstream from a primary lung focus. Skeletal tuberculosis makes up about 10 to 15% of extrapulmonary tuberculosis and 1 to 2% of all tuberculosis cases. Percentage of regional distribution of skeletal tuberculosis is spine, 50% of all of the skeletal tuberculosis, hip, common and next to spinal tuberculosis, knee, next to hip tuberculosis, foot, elbow, hand, shoulder, respectively. Now, risk factors include malnutrition, poverty, HIV infection, alcoholism, cross immunosuppression from arthritis therapy. Pott's disease. The classic radiological picture of two vertebral disease with the destruction of the intervertebral disc, most commonly affecting T8 to L3 vertebrae. The clinical features. Back pain. The patient typically presents with backache. Back pain in tuberculosis can be related to the active disease itself, bone destruction, and instability. Rest pain is pathognomonic and rarely radicular pain can be the main presenting symptom. Deformity. It is owing to the greater involvement of anterior spinal column in tuberculosis. The spinal column progressively develops a kyphosis, especially in the thoracic and thoracolumbar spine. Instability involves progression of deformity even years after healing of the infection. Neurological deficit. It can occur either at the active stage of the disease or during the healed stage. Cold abscess. These abscesses typically lack all the inflammation signs obvious in abscess. Now, pediatric spinal tuberculosis. Due to the immaturity and increased flexibility of spine in children, they are prone to developing severe deformity progression such as worsening of deformity in children can also occur after the disease has completely healed. Constitutional symptoms including loss of appetite, weight loss, fever, and fatigue. Diagnosis and investigations. CT showing destruction, squastra and abscess, MRI showing abscess, erythrocyte sedimentation rate and tuberculin skin test can also be used to investigate tuberculosis. Aims of treatment are to eradicate the disease, to prevent or correct deformity, to prevent paraplegia. Medication. Anti-tuberculous drugs from the basis of the treatment including rifampicin, isoniazid, para-aminosalicylic acid and ethambutol. Indications for surgery. No response to chemotherapy, large abscess, spinal cord or nerve compression, multiple vertebral involvement, patient younger than 15 years with kyphosis greater than 30 degrees. Physical therapy management. Patients with Pott's disease often undergo spinal fusion or spinal decompression surgeries to correct their structural deformity and prevent further neurological complications. Treatment regime should address each patient individually. Physical therapy management after post-spinal decompression surgeries include spinal stabilization exercises and strengthening exercises. Physical therapy management after post-spinal fusion surgery include TENS, which may reduce neuropathic pain, aquatic therapy, walking program, aerobic exercises, and trunk strengthening exercises. Patient education, isolation, strict compliance on long-term chemotherapy, regular follow-up.